started the conversation with saying he wasn't a provider, but has ended up being not only a provider, but a good insight partner. So this is a doctor exactly like what Edna said, who got fed up of hearing about the golden solution to all their problems and went and actually solved them and created a company. So Harold, on to you.
And I would just like to say good evening. I am, as you said, Dr. Harold Arkoff, and I've been a practicing physician for over 30 years, first as a surgeon and then as an anesthesiologist. I was invited here today to present my own perspective on connected healthcare in the acute care setting. This, of course, is my area of expertise. I believe that the universal problem facing healthcare today is simply a lack of communication and nothing else. Communication takes many forms and includes both digital and verbal. Just imagine what would happen if every doctor could see all pertinent and relevant data, including waveforms, video, and DICOM images from all of their patients whenever and wherever they need it. There are three main issues facing healthcare in the United States, all exacerbated by COVID-19. Lack of medical device interoperability, medical errors in hospitals, with estimates exceeding 250,000 deaths annually, making it the third leading cause of death, and finally, physician burnout, and unfortunately, suicide. Data and communication are the keystone to addressing these issues. What is needed now is real-time health data, information, and team communication at the point of care. The biggest structural barrier to solving these issues is lack of connectivity and lack of interoperability. The solution lies with IoMT, the Internet of Medical Things. IoMT simply connects the physical world of medical devices and equipment to the digital world. Every other industry has benefited from IoT, smartphones, and broadband. Yet healthcare has not fundamentally changed in the past 30 years. We're still using pagers, faxes, and desktop phones. This, to me, is a really big problem. The right data simply does not get to the right person at the right time, especially when time is a limiting factor. But what if diagnostic and workflow challenges could be solved with a single architecture, one that could unify data, improve monitoring, eliminate data entry problems, and improve both team communication and team collaboration? Let me show you what we have done. My team and I have created a solution for connecting care providers to their patients in real time. We call it OneSource. OneSource automates real-time collection, aggregation, and time synchronization of data and video from bedside and other devices, including ventilators, even in a multi-vendor environment, to provide a holistic view of patient data and information. This makes it possible for the entire care team to access the same data independent of their location. OneSource provides real-time situational awareness, team communication, and team collaboration. It's all about getting the right data to the right person at the right time. In the status quo, patient data from medical devices is entered into the electronic medical record either manually or automatically. Either way, it's extremely low-frequency data. Typically, this does not represent more than 15 to 20 data samples per hour, even in the intensive care unit. The rest is lost forever. OneSource represents a paradigm shift. We capture more than 6 million data samples per hour per patient. Simply, we can record and time synchronize to the millisecond an exact copy of all medical device data. This represents a quantum leap in technology that can produce tremendous productivity gains while decreasing medical errors and thus save lives. In this first use case, OneSource allows care providers to remotely view their patients when they need it in real time from different types of medical devices from multiple vendors. This has been especially valuable in providing a clinical distancing and remote viewing solution for COVID patients. In this second use case, we are demonstrating the power of artificial intelligence by leveraging our IOMT technology stack to simultaneously capture full resolution ECG signals from all connected hospital patients, thereby creating a virtual Holter monitoring system for not just one person, but an entire hospital. OneSource now makes it possible to deploy this technology to any connected patient anywhere in the world. I would like to close with 3 key points. First, I believe that a single architecture like OneSource that unifies data, improves team communication and team collaboration, is the keystone to improving patient care. Second, our open architecture platform disrupts current market forces that have limited adoption of new technologies. OneSource lowers existing structural barriers, democratizing the process for healthcare innovators to enter the market, and provides them a global audience for their products. Finally, OneSource is built to evolve. Its data comes AI-ready for machine learning, predictive modeling, augmented intelligence, and edge computing. It also features an open standard for easy integration of third-party software. That is to say, as technology grows, so does OneSource. Thank you, and I look forward to taking questions.
Thanks, Harold. I think that was interesting. It's clearly a solution that a lot of people have been asking us about. Yusuf and Dr. Shafi, or maybe Harold, any of you have a view on this around the CDS, the standardization piece?
I think standardization to a certain extent has its own value, specifically as it relates to the explosion of data. At least here in the United States, the patients I'm taking care of today are much sicker than they were even 10 years ago. There's a huge explosion of data, and from even my own father's experience in the hospital at a major HMO here in the United States, the intensivist was overloaded with information. In fact, he was the only person on call at night. He had to cover the emergency room and 20 critical patients, and he relied upon the nurses to notify him when patients weren't doing well. So the idea of standardizing and having these systems is to actually, I will call it augmented intelligence, filter out the noise and elevate what's important. So I do think that the standardization is there and needed to filter out all the noise for doctors who are overworked.
Thanks a lot.